Thanks so much for staying up with us tonight at 10. I'm Marlisa Goldsmith. Arkansas has been in phase 1 of reopening for more than about a week now. But today, the governor says we can't get ahead of ourselves. Tonight, THV 11's Ashley Godwin finds out what his message could mean for the local economy. And we want to hear from you. Go to thv11.com/vote and tell us, is Arkansas ready to enter phase 2?
Just as North Little Rock was beginning to reopen, Governor Hutchinson put a stop to any further plans.
We're not prepared to go into phase 2 next Monday, so in that sense, it does delay us.
There's no doubt that I'm just as disappointed as the governor is.
Just this week, North Little Rock announced pools and pavilions will have limited openings. Mayor Joe Smith says this will continue until the Arkansas Department of Health says otherwise.
We're doing exactly what Dr. Smith has told us that we're allowed to do, that's safe, and at the same time give our children an opportunity to enjoy some of the summer.
And down the street, Simmons Bank Arena is feeling the impacts of a long-term, now even longer, closure.
We're one of the first ones to close, and we're going to be one of the last ones to open. We don't get any money from the taxpayers. The events is what keeps us going. Now, we certainly, over the years have set aside a reserve fund, but that won't last forever.
But the general manager says he doesn't want to compromise the safety of Arkansans by opening too soon.
We want this to work right, so if we got to wait a little longer so everybody feels good about coming back here, then that's fine.
Governor Hutchinson said he wouldn't give a timeline as to how long it would take until we reach phase 2, but he did say it would take a decrease in cases before he even considered the idea. In North Little Rock, I'm Ashley Godwin, THV 11 News.
Ashley, thanks so much. In an update to a story we've been following this week, a music venue in Fort Smith has officially postponed a concert that was set to happen tomorrow. The announcement by Tempo Live came less than 2 hours after the ABC suspended the venue's alcohol permit, saying it would remain suspended unless the concert was canceled. In a press conference today, the venue's manager said, quote, "We fought the law and the law won."
The spotty showers and storms that we saw earlier this evening have died out, but it is still warm and humid around the region. Temperatures are pretty much into the 70s as we take a look at the radar loop with temperatures at 66 in Clinton, 73 in Stuttgart, still 76 in Hot Springs. Through the rest of the overnight, small chance of an isolated shower. But Friday is going to be a changeable day. We'll be watching a line of showers and storms weakening as it moves in here from the north. But that is going to be the trigger for scattered showers and storms to develop through the course of the day. First in northern parts of the state, and then as that boundary moves through, we'll have that opportunity of scattered showers and storms to pretty much affect anyone across central Arkansas. And some of these storms could be on the strong side. There is a low threat off to the west of severe weather, but all of Arkansas could see some strong storms with some gusty winds, maybe even some small hail. I'll have your weekend forecast coming up.
All right, let's take a look at the numbers tonight. This chart right here shows the number of new cases reported each day in Arkansas since our first case back in March. Today we have 130 new cases, which is the biggest jump we've seen in about a week. We also know more than 3,300 people have recovered and 98 have died. THV 11 learned today one of the state's COVID-19 deaths was a man known as the blue light rapist. Robert Birmingham was convicted in a string of rapes that drew national attention. Prosecutors accused him of using flashing blue lights to impersonate a police vehicle. They say he'd pull women over, then kidnap and rape them. A victim who testified against him in court, Shannon Woods, told THV 11, quote, "I had many different emotions, but I am relieved he's deceased." 900 inmates were infected at the Cummins unit. Birmingham is among the 8 who have died. Now that Arkansas businesses are starting to reopen, you may come across screening questions that you'll have to answer before you're allowed to enter. Some of you have told us they seem a little vague, so tonight we verify exactly what they mean to help you answer the questions correctly. If you've left your home in recent days and gone to a gym, dentist, or salon, you may have been greeted at the door with a questionnaire. On there, You could see a question asking if you've had contact with someone who tested positive for COVID-19 in the last 14 days. One viewer asked us to clarify what this exactly means. To verify the answer, we turn to the Arkansas Department of Health. A spokesperson answers, saying that would be had contact in the last 14 days with someone who is actively infected, meaning that person hasn't been declared recovered yet. If the person has recovered at the time of contact with the person in question, it's fine for you to enter the business. Question 2. If a person has tested positive but had mild symptoms, do you say yes? According to the Department of Health, the level of symptoms does not matter. What matters is if they are currently infected and you've had contact with them. You should not go into the business. Final question. If you are a nurse or healthcare provider and have worked with COVID-19 patients, do you mark yes? ADH says if a healthcare provider or nurse was properly using personal protective equipment the entire time they interacted with COVID-19 patients, they are considered low risk and can mark no, but only if they properly used PPE the entire time. If you have something you'd like verified during this pandemic, let us help. Email us or send us a message directly on social media. COVID-19 testing is a hot button issue as this pandemic unfolds. Some leaders say anyone who wants to get a test can. And while an effort is underway in Arkansas to make that happen, it's not that simple in other states. Brendan Keefe from our Atlanta affiliate takes a closer look.
102 fever. Day 2 of who knows how many. Feels like I can't breathe. The deeper the breath is I take, the more it actually hurts.
Jason Hartelius ended up in the hospital.
Still do not have test results yet. It's been 7 days since I got tested, so numbers you're seeing, not even close to accurate. They're probably much, much higher than what you're seeing. I'm not a statistic yet.
You were actually in the hospital for days with presumptive COVID-19, but you still didn't know because at that point it was taking days to get results, right?
Got worse, went to the hospital, was treated for 3 days, was discharged from the hospital, and then my test results came back the next day.
He was positive, so he had to isolate himself in a bedroom and stay away from his wife Katie for more than 3 weeks because she couldn't get tested.
Day 25 of isolation. I feel like I just got out of prison.
You have not been able to get a test now for months, right?
No, almost 2 months were going on and no test.
No, I haven't been able to get a test to confirm that I'm negative. She was never able to get a test to begin with.
The President of the United States said anyone who wants a test can get one. Is that your experience?
No,
No.
Not at all. And I watched him say that from my bed in the hospital, knowing my wife couldn't get a test.
And I've had a cough off and on for a couple of weeks.
And you still can't get a test?
No, they said I can get tested. They'll give me an antibody test, but I need the cough to go away to get the antibody test.
Let's take a closer look at the coronavirus. As we zoom in, there's that familiar shape. But let's go inside the virus to see what the diagnostic tests are actually looking for. It's these blue strands right here. This is RNA. These are the nucleic acids that are essentially the genetic fingerprint of the virus. That's not what the blood tests are looking for. Those are looking for the antibodies that your immune system produces to hunt down the virus in your body and destroy it.
Both the diagnostic tests for the virus and blood tests for antibodies were approved on an emergency basis without full FDA review. While testing is ramped up nationwide, it's far from universal. Some supplies have run out, and each state has its own requirements to access testing. Jason recently ended up back in the hospital in Pennsylvania with complications from COVID, and they wouldn't retest him.
I've never been told we don't have enough tests. The language they use, and I've been told this multiple times by multiple doctors, is your current situation just doesn't meet the protocol for a test, which is a nice way of saying we don't want to use one on you.
Meanwhile, some states like Georgia have opened up testing to everyone regardless of whether they have symptoms or not. This week, I tried booking the free federally backed CVS drive-up diagnostic testing at Georgia Tech, but they still require symptoms or suspected exposure, so I didn't qualify. But I was able to get an antibody test at Quest Diagnostics, no questions asked. Quest will test the blood of anyone who is not sick if you're willing to pay the $129 retail price up front.
I have plasma that could help people currently very sick, but I can't donate the plasma because I haven't had the test to confirm I'm negative, because they don't want to waste the test on me to prove that I'm negative.
And so it remains a nation of testing haves and have-nots.
Here in Arkansas, the governor wants to test 60,000 people for coronavirus this month. And to help do that, more than 50 clinics will now offer tests to anyone who wants them. Up until now, testing in Arkansas focused on people with symptoms or who had been in contact with a positive patient. The Community Health Centers of Arkansas is dropping those limits. Text the word TEST, that's T-E-S-T, to 501-376-1111, and we'll send you information about where and how to get tested. Tonight's THV 11 senior shout out goes to Kiara Williams. She's graduating in the top 10% of her class at eSTEM and is a member of the National Honor Society. Kiara plans to pursue a nursing degree at the University of Central Arkansas in the fall. Congratulations to her and all graduating seniors across the state. Don't forget, you can nominate a senior for a shout out at thv11.com/class of 2020. If you thought you heard the rumble of jet engines this afternoon, no, you're not crazy in quarantine. The Blue Angels did a special flyover above Little Rock. Take a look.